Okay, welcome back. We will continue our video series on pharmacology for health professionals. In this video, we will discuss chapter number 7, urinary drugs. Learning objectives for this chapter: compare and contrast the site of action and the therapeutic effects of various diuretic drugs. Explain why potassium chloride drugs are given to patients taking diuretics. Describe the therapeutic effects of drugs used to treat urinary tract infections, urinary tract pain, urinary tract spasms, overactive bladder. Compare and contrast the therapeutic effects of drugs that are used to treat the male urinary problems of benign prostatic hypertrophy and erectile dysfunction. When given the name of a well-known urinary generic drug, identify its trade name. When given the generic and trade names of a urinary tract drug, identify what drug category it belongs to and what disease it is used to treat. When given a urinary tract drug category, identify several generic and trade name drugs in that category. And lastly, when given an ending common to several generic drugs, identify the related drug category. All right, we'll start off with an introduction. Urinary drugs include a variety of different things. These can include diuretic drugs, could be potassium supplements. These are often taken concurrently with diuretics. Drugs that are used to treat urinary tract infections, urinary tract analgesic drugs, urinary tract antispasmodic drugs, drugs that will treat overactive bladder, drugs for BPH, benign prostatic hypertrophy, drugs for erectile dysfunction, and drugs for prostatitis. So all these drugs I just listed all fall in the category of urinary drugs because they involve the urinary tract in some manner. All right, we'll start off with diuretic drugs. Of course, the main organ of the urinary system would be the kidneys, and the kidneys continuously filter circulating blood, and depending on the needs of the body, will extract and excrete waste products of metabolism. Now also, depending on the needs of the body at that time, the kidneys can extract and either excrete or reabsorb non-waste products. And these non-waste products can include water, sodium, potassium, electrolytes, either positive or negative electrolytes, and glucose. Now, diuretic drugs keep sodium and potassium from being reabsorbed from the renal tubules back into the blood. So this extra sodium and potassium can cause an increase in the volume of urine. So by causing this excess sodium and potassium and water to be excreted, diuretic drugs are useful in treatments for hypertension, edema associated with congestive heart failure, renal failure, and cerebral edema. And the whole point of diuretics is to prevent sodium and potassium and excess water adding volume to your blood, which means the heart would have to work harder to pump the blood volume throughout the body. Diuretics are divided into several categories, and they're based on the site of the drug's action in the nephron. And the nephron is the main functional unit of a kidney. Now, some of the categories of diuretics: thiazide diuretic drugs, loop diuretic drugs, potassium-sparing diuretics, osmotic diuretics, and carbonic anhydrase inhibitor diuretics. All right, first one we'll mention are the thiazides. These will act on the loop of Hindley and also on the distal convoluted tubules in the nephron. And the way these work are they block sodium and potassium from being reabsorbed from the renal tubules back into the blood. Now, when this happens, you have a lot more sodium and a lot more potassium than normal being excreted into the urine. Along with that, also a lot of water. So these are often called potassium wasting drugs because so much sodium is excreted out, so much potassium is excreted out. Some common examples of thiazides. As these drugs are listed here, you have the generic name first and then the trade name in parentheses. So some examples of this category would include benzo-flumothiazide, sold as under the trade name Naturatin; chlorthalidone, sold under the name Hydroton; chlorthiazide, under the name Diuryl; and hydrochlorothiazide, sold under the name HCTZ or hydrodiuryl or microzide. Some other examples of this class: indapamide and also methiclothiazide. Both of those are sold under the name Enduron; metallazone, sold under the trade name Xeroxilin. And one thing that you'll notice when it comes to this class of diuretics, the ending thiazide is very common in the generic drug name. Now, the thiazide group of diuretics causes adverse drug interactions with many different kinds of drugs. So thiazides will keep anticoagulant drugs from working effectively to prevent blood clots. Well, they also can decrease the effect of some types of insulin that are used to treat diabetes mellitus. However, when taken in combination with other types of drugs, they have the opposite effect and actually prolong the effect of the other drug, which could cause severe side effects or even toxicity. And this is true for chemotherapy drugs, for cancers, and for lithium, which is used to treat the manic phase of bipolar disorder. Another category of diuretics, the loop diuretic drugs. These will act on the proximal convoluted tubule, and also on the loop of Henle and on the distal convoluted tubule. And this class of diuretics get their name because they act on the loop of Henle, and that structure is also known as the nephron loop. Now, this category of drugs will block sodium and potassium from being reabsorbed from the renal tubule back into the blood. Now, the actions of category of diuretics is similar to the thiazides. They block sodium and potassium from being reabsorbed from the renal tubule back into the blood, but even more sodium and even more potassium than usual is excreted into the urine. And also, a lot more excess water is excreted into the urine. So these are another type of potassium wasting drugs. And these are a lot stronger and waste more potassium than the thiazides do. Some common examples of this category of diuretics: bumetanide, sold under the trade name Bumex; ethylcrinic acid, sold under the name Edequin; furosemide, a very common, very popular loop diuretic, sold under the name Lasix; and last one here, torsemide, sold under the name Demodex. Another category of diuretics are potassium-sparing diuretic drugs. These will act on the proximal convoluted tubule and the loop of Henle. Now, these cause sodium and water to be excreted into the urine, but they conserve or they spare potassium and allow it to be reabsorbed back into the blood. Some common examples of this category: amiloride, sold under the name Mitamor; spironolactone, sold under the name Aldactone; and the last one here, triamterene, sold under the name Direnium. Another thing that you will see when it comes to diuretic drugs is you'll often find drugs that have a combination of these categories. So they're not just thiazides, they're not just loop diuretics, not just potassium sparing. They are a combination of two or more of these categories. Some drugs that you will commonly see included in a combination diuretic drug: hydrochlorothiazide, that represents the thiazide group of the diuretics. And three common examples of the potassium sparing category that you'll find are amiloride, spironolactone, and triamterene. See, for example, the drug aldactazine is really a combination of hydrochlorothiazide and spironolactone. The drug diazide is a combination of hydrochlorothiazide and triamterene. Another example of a combination diuretic would be Maxide, that is a combination of hydrochlorothiazide and triamterene. The drug Diuretic is a combination of hydrochlorothiazide and amiloride. Alright, now we'll talk about potassium chloride drugs. These are frequently prescribed for patients who are taking either a thiazide or a loop diuretic drug. Because both of those cause so much potassium to be wasted into the urine, you don't want that patient to risk losing too much potassium. So the way to counteract that would be to prescribe a potassium chloride drug. Now, these can be manufactured in multiple forms. They can be formed in a liquid, but patients often object to the taste of this medication. They can be found in powders or in effervescent tablets, or in capsules or in tablets. Now, this type of drug are measured in a unit called MEQs, milli equivalents. And something that you'll notice for all potassium chloride drugs is the presence of the letter K in each trade name. And that K is a reference to the elemental symbol for potassium, which is K. Some common drugs that fall under this category: K-Seal, K-Dur, K-Lor, and Chlorcon. Some other examples: Chlorves, Clotrix, K-Lite, K-Tab, and Micro-K. And again, the letter K is present in all of these. In this image we have an example of a bottle of Chlorcon, and on the bottle you'll see the dosage, which is 10 milliequivalents, or 10 MEQs, and that is equal to 750 milligrams. Both the thiazides and the loop diuretics can cause sodium and potassium and water to be excreted in the urine, but this extra loss of potassium can have some adverse effects on some patients. And some of these effects can include cardiac arrhythmias. So patients who take a thiazide diuretic or a loop diuretic will also take a potassium-sparing diuretic drug to offset that loss of potassium. Or that patient could take a oral potassium supplement. Although foods such as bananas are high in potassium, the dietary sources of potassium are usually not sufficient enough to replace the loss of potassium that's caused by these diuretics. Alright, now we'll talk about drugs that are used to treat urinary tract infections. Urinary tract infections, or UTIs, are treated with drugs that are particularly effective against the gram-negative bacteria that causes the infection. And the frequent cause of UTIs is the bacteria E. coli. And there are several categories of drugs that act systemically to help treat UTIs. And here are some categories of drugs that will act systemically on a patient to help treat UTIs. There are the penicillin antibiotic drugs, the cephalosporin antibiotic drugs, the quinolone antibiotic drugs, fluoroquinolone antibiotic drugs, sulfonamides, anti-infective drugs, folic acid antagonist drugs. And we'll talk about a few of these categories here. First one we'll talk about quinolone antibiotic drugs. Some examples of this category would include sonoxacin and also nalidixic acid, which is sold under the name Negram. And that name, Negram, was chosen because this drug is effective against gram-negative bacteria. See, folic acid antagonist drugs. These work because they block the formation of folic acid in bacterial cells. So this interferes with the ability of some bacteria to reproduce. And some examples of this category of drugs would be trimethoprim, which is sold under the names Primsol or Proloprim. Some other antibiotic type drugs that are used for UTIs. The drug is metabolized to an acid that is excreted into the urine, where it kills the bacteria. The drug is changed in the urine into chemicals of ammonia and formaldehyde, which end up killing the bacteria. See, the drug is given orally, but changed by the bacteria themselves into a substance that interferes with the DNA and the bacterial reproduction. And some examples of this type of drug would include acetohydrozamic acid, sold under the name Lithostat, fosfomycin, sold under the name Monorol, methenamine, sold under the name Urex or Hyprex, and nitrofurantoin, sold under the name Macrobid or Macrodantin. And like we saw with the diuretics, it's not uncommon to see a combination of antibiotic drugs that are used to treat UTIs. These will often contain antibiotic drug trimethoprim, because this blocks one step of the synthesis of the folic acid by the bacteria. It will also include an anti-infective sulfa drug, sulfamethoxazole, and this blocks the next step in the same process. So these two individual components work synergistically to help prevent folic acid synthesis by bacteria. A quick did you know? A cranberry juice is effective in preventing urinary tract infections. That's because the cranberries are acidic, which is why eating the berries makes your mouth pucker. Now, after you eat these, the cranberries will temporarily increase the acidity of your urine, and this will suppress the growth of bacteria because the bacteria would prefer to have an alkaline or a basic environment, not acidic. Also, cranberry juice contains the simple sugar fructose, which acts as an anti-adhesion factor that helps bacteria from adhering to the bladder wall. So if they can't stick to the inside of the bladder, then they can't make you sick. Okay. And when it comes to urinary tract analgesic drugs, there are some indications that require the patient to take this kind of drug. Some examples of this would include having a urinary tract infection or urinary tract disease, having interstitial cystitis, having urinary tract surgery, and having an endoscopic procedure. So any one of these four may necessitate a patient taking a urinary tract analgesic drug. Common symptoms that would indicate that you have a urinary tract infection would be burning, urgency, and also painful urination. So all these would necessitate the taking of an analgesic drug. Now, these types of drugs will exert a local pain-relieving effect on the mucous membranes of the urinary tract, even though drugs are given orally. So when it comes to urinary tract analgesic drugs, they are taken orally by the patient. They exert a local pain-relieving effect only on the mucous membranes of the urinary tract. Some examples of these types of drugs would include pentosan, which is sold under the name Elmiron, and also phenazopyridine, which is sold under the name Pyridium or Eurogesic. Now, a note about the drug Pyridium. This will turn the patient's urine a red or a reddish-orange color. So it's important that the patient not mistake the color of the urine for the actual presence of blood in the urine. Just because it has the same color as blood doesn't mean that it is blood. Alright, next we'll talk about urinary tract antispasmodic drugs. And the patient may have spasms of the smooth muscle of the urinary tract due to infections or catheterizations, kidney stones, or urinary retention. So the purpose of urinary antispasmodics is to relax the smooth muscle. And here are some common examples here. Bethanacol, which is sold under the name Erectile, Flavoxate, sold under the name Eurispus, and the last one here, hyoscyamine, which is sold under the names Antispaz or Cystospaz. Okay, now we'll talk about drugs that are used to treat overactive bladder. And some common symptoms for an overactive bladder include urinary urgency, urinary frequency, and urinary incontinence at times. And all these symptoms are due to the involuntary contractions of the bladder wall as the bladder fills with urine. And the drugs that are prescribed to treat an overactive bladder work in various ways. The first kind we'll talk about are the anticholinergic drugs. And they're called that because they block the action of the neurotransmitter acetylcholine. And some examples of this kind of class would include darafenacin, known by the trade name Anablex, fesoterodine, also known by its trade name Toviaz, oxybutynin, known by its trade names Ditropan, Gelneek, and Oxetrol, solifenacin, known by its trade name Vesicare, tolterodine, or known by its trade name Detrol, and trospium, known by its trade name Sanctura. Other types of drugs that are used to treat overactive bladder act because they reduce the smooth muscle tone of the bladder wall. An example of this kind of drug would be mirabegron, known by its trade name Myrbetriq. And other drugs can treat an overactive bladder because they relax bladder contractions. An example of this would be Anabotulinum toxin A, also known by the trade name Botox. Now we'll talk about drugs that are used to treat BPH, benign prostatic hypertrophy. Now, BPH is common in men over the age of 50, and the incidence of this condition increases with age. So the older you are, the more likely you are to get it. And what happens with this condition is the prostate gland will hypertrophy, which is another term for enlarging. This is caused by a chain reaction in which testosterone is acted on by an enzyme in the cells of the prostate. And that enzyme gets converted to dihydrotestosterone. And this causes the prostate gland to enlarge. And this enlargement is benign and not cancerous. Some common symptoms of BPH: having difficulty in initiating the urination stream, having hesitancy while urinating, and having a decreased urinary stream. Some treatments for BPH will include androgen inhibitor drugs and also alpha-1 receptor blocker drugs. When it comes to an androgen inhibitor drugs to treat BPH, the term androgen refers to all of the various male hormones. So it's not just one specific hormone, it is all of them. And the way that this kind of class of drugs will work is they inhibit the male hormone dihydrotestosterone. So by inhibiting this hormone, it will reduce the effect on the prostate gland. So it will cause the swelling to go down. And this kind of drug needs to be taken for anywhere from 6 to 12 months in order to see if it's effective or not in decreasing the size of the prostate. Some examples of this kind of class of drug would be dutasteride, also known by the trade name Avodart, and finasteride, also known by its trade name Proscar. And this drug has also been shown to decrease the incidence of cancer within the prostate gland. Alright, now a quick drug alert. Because the drugs dutasteride and finasteride are androgen inhibitor drugs, their drug inserts, packaging, and advertising warn women not to take these drugs or even handle them. And this is because of the possibility that if the woman is pregnant or might become pregnant with a male fetus in particular, the drugs would block the normal male fetal development and will cause birth defects. Another kind of drug that could be given to treat BPH are the alpha-1 receptor blocker drugs. And these work because they block alpha-1 receptors in the smooth muscle of the walls of the urethra and of the prostate gland. And by blocking these receptors, this will cause the smooth muscle to relax, allow the urine to flow more easily. And there are only a few alpha-1 receptors in the neck of the bladder. So this kind of drug does not relax the muscles in the bladder, and this kind of drug does not cause incontinence. Some examples of alpha-1 receptor blocker drugs for BPH include alfuzosin, known by its trade name Urozextrol, doxazosin, known by its trade name Cordura, tamsulosin, known by the trade name Flomax, and terazosin, known by its trade name Hytrin. I now talk about drugs that are used to treat erectile dysfunction. Now, erectile dysfunction is the inability of a man to achieve and maintain an erection during sexual intercourse. And the sexual stimulation of a male activates the chemical cGMP. Now, this chemical will relax the smooth muscle within the arteries of the penis, which will allow more blood to flow through it, which will lead to an erection. When that stimulation is over, the enzyme PDE5 metabolizes the chemical cGMP, which will cause the erection to resolve itself. And there are various different types of drugs that could be given to treat ED. The first one we'll talk about are the PDE5 inhibitor drugs. And PDE5 stands for phosphodiesterase type 5. So examples of this kind of drug would be Evanafil, also known by the trade name Stendra, Sildenafil, also known by the name Viagra, Tadalafil, known by the trade name Cialis, and Vardenafil, known by the trade name Levitra. Another class of drugs you could give to treat erectile dysfunction are prostaglandin E1 drugs. And these will act locally to relax the smooth muscle within the arteries of the penis. Once that happens, there's an increased blood flow to the penis that will help create an erection. Now, this kind of drug will require the patient to have to undergo some training to use it properly. Once that patient has gone through the training, they'll be taught how to inject the drug into the side of the penis. And that kind of drug could be either Edex or Carvaject, or they would learn how to insert a pellet into the urethra. And that pellet would be a dosage of the drug Muse. So Carvaject, Edex, and Muse are all brand names, all trade names for the generic drug of alprostadil. I now mention a drug alert. Although the PDE5 inhibitor drugs for ED improve the quality and duration of an erection in men with erectile dysfunction, the drug inserts and advertisements warn that men experiencing an erection that lasts longer than 4 hours should see a physician or go to the emergency room. Now, this adverse effect might occur more often with the drug Cialis. because its duration of action is 36 hours, compared to only 4 hours for Viagra and 5 hours for Levitra. All of the PDE5 inhibitor drugs that we mentioned can also cause a temporary loss of the ability in the male to see blue-green colors. I'll now talk a little bit more about prostaglandins. Now, prostaglandin is a naturally occurring body substance that was first isolated from the prostate gland, which is where it derives its name. Prostaglandins are present in many different tissues in the body, and when they're used as drugs, can have several different actions. Prostaglandin E1 drugs cause vasodilation, which is helpful in treating erectile dysfunction. Prostaglandin E1 drugs are also used to keep open a patent ductus arteriosus to sustain the life in a newborn with a congenital heart defect such as tetralogy of Fallot. Prostaglandin E2 drugs stimulate smooth muscle in the walls of the uterus and are also used to induce premature labor and to terminate a pregnancy. Okay, that brings us to the end of chapter number 7 in our video series on pharmacology. We will continue our course with our next video on chapter number 8, gastrointestinal drugs.